Okay, we're going to be taking a look at a Layrnx model and the different features on it pertinent to the respiratory system. Okay, so we have the hyoid bone right here, and we have the lesser horn of the hyoid bone. Then we have this membrane right here, which is the thyrohyoid membrane, which is going to be in between the thyroid cartilage and the hyoid bone. And as stated, this is the thyroid cartilage, and you would have a superior thyroid notch and this little protuberance right here. A little more, a better view. Sorry, you kind of see how it bumps right there. That would be the laryngeal prominence, or otherwise known as your Adam's apple. Now going down, we have the cricoid cartilage, and we have tracheal rings, tracheal cartilage basically, and then we have the thyroid gland itself. We also have cricoid muscle and thyroid muscle. Now, so on the lateral view, there's not a lot of new surfaces to cover. This is just the lateral view of the hyoid bone, but you are going to be able to differentiate the greater horn of the hyoid bone, which would be right there, and then the lesser horn, which would be right here. Another thing you would find are your superior laryngeal nerve and the superior thyroid artery branching out here. We'd also have your inferior pharyngeal constrictor muscle, which would be right here, but it's not really visible, unfortunately, on this model. So we'll just go down here where we have our cricoid thyroid muscle, and then you have your laryngeal prominence, Adam's apple, and we're going to go ahead and go to the posterior view. So we're looking at the posterior view of the larynx, and right off the bat, you should know this is going to be your epiglottis. This is the flap that flops. This is what is closing to make sure nothing goes down your windpipe. And then on the lateral sides of the epiglottis, you would have the greater horn of the hyoid bone. And then on the sides, this would just be your thyroid cartilage. But as we go in, we have this little indentation right here. This little indentation, and it's going to be your piriform recess. And then going down here, this is your trachea. And then you're going to have your cricoid cartilage, and you actually have a posterior cricoid arytenoid and as we move a little bit more up, this muscle kind of going diagonal, it will be your superior, your superior thyroid arteries right here. And this right here is going to be your arytenoid muscle. You have an oblique and transverse. You have your arytenoid muscles right here. And you have your arytenoid cartilage, which will be deep to this. Then you would have your corniculate tubercle, which is kind of right here. Oh, I'm sorry about that. Is corniculate tubercle, and you have a cuneiform tubercle, which would be a little bit up here. Okay, so we're looking at the mid-sagittal section of the larynx. So right here you would have your epiglottal cartilage, and you have your hypoepiglottic ligament.
Hey Nathaniel,
so
you got some pretty honest answers here.
So we have your laryngeal vestibule, and going right here you have the transverse arytenoid muscle. This is going to be your vestibular fold, and kind of within right here, this is going to be your laryngeal ventricle, and kind of under, it's hard to tell, but it's a little white. That is going to be your vocal fold. So right here you kind of have your cricoid cartilage. So this is also going to be your cricoid cartilage, but this is going to be the anterior view. So kind of remember where you're oriented when you're looking at this. This is the anterior cricoid cartilage. Sorry about that. And then as we go up here, it's going to be the anterior, kind of the anterior, but it's basically going to be your laryngeal prominence of the thyroid cartilage. So right here, this little section is going to be your pre-epiglottic fat pad. And as you go more anterior, you have your thyrohyoid ligament. And right here is going to be your hyoid bone.